Hello friends, I am Dr. Shekhar Srivastav, orthopedic consultant, and I have got special interest in knee and shoulder surgery. Before we understand the injuries of the knee joint in young persons, I would like to tell you the structure of our knee joint. So if you see, this is a model of normal human knee joint. Now this is our thigh bone and this is the leg bone. In between these two bones, you will find some rope-like structures which join these two bones. So these are known as ligaments. So we have got two ligaments by the side, one ligament which is going from front to back and the other which is coming from back to front. So these are the four ligaments of the knee joint, and these ligaments frequently get injured in young patients. Now they may be injured in sporting activity, especially in sports such as football, soccer or basketball, or in road traffic accidents. ACL is the most commonly injured ligament of the knee joint, and it is commonly injured in sports persons who are involved in sports such as soccer, football, kabaddi, basketball. In our country, we see a lot of these injuries in persons who are involved in two-wheeler accidents. Frequently, because of imbalance, the scooter or the bike falls on patient's own leg, and this leads to ACL injury. Now, this injury is mostly occurring in young persons in sports when they have to suddenly make a stop, or they jump inappropriately, or when there is a tackle such as in football. So these type of activities lead to ACL injury. The treatment of ACL injury is dictated by patient's level of activity and the degree of injury. Now, first thing is I want to make clear that ACL doesn't heal by itself. So once it is torn, it requires some type of surgical repair for healing. So is there any non-surgical treatment for ACL injury? Yes. In persons who are elderly, who doesn't have too much of demand, who live a sedentary life, in those cases one can opt for non-surgical management. So in non-surgical management, what we do, we initially wait for the swelling and inflammation to subside. We give ice packs. We ask the patient to use a brace while walking. Now once the swelling has gone down, the patient has regained his range of motion, then they go for various strengthening exercises for their leg muscles so as to gain balance on their knee joint. So that is a non-surgical management. But in young active individuals who are involved in high demand activity, strenuous jobs, sports persons, they require surgical treatment. In young persons who have ACL injury or persons who have instability because of ACL injury, they require surgery for ACL repair. Now ACL, we cannot stitch the ACL together. The torn ACL can't be stitched back. It has to be reconstructed. So reconstruction is done by taking graft from patient's own body. And all this procedure is done arthroscopically. So arthroscopically is a minimally invasive technique in which small keyhole incisions are made in the knee joint through which instruments are passed and surgery is performed. So these incisions are very small. You can say like the back of your pen, around 4 millimeter, and two holes of this size are made on both sides of the knee, one on this side and the other on this side, and through which instruments and the camera is put inside the knee joint and the surgery is performed. Now the advantage of this surgery is that as your incision is very small, you are not cutting the muscles, so there is very less pain. The patient's activity is not hampered. Patient can get his functional range of motion very early. There is less pain. The hospital stay is very short, and the patient can get back to his work quite early. Rehab or physiotherapy is a very important part of ACL injury and ACL healing. Now, whether it's a non-surgical management or surgical management, rehab is very essential to gain full function of the leg. The first principle of rehab is to reduce the pain and swelling, and that is done by applying ice over the affected part. Once the swelling has subsided, then the second role is to get full range of motion. That is done by exercises, and after that strengthening exercises of the thigh muscles is done. So the main purpose is to gain strength in the leg muscles, to gain balance in the leg muscles, but still protecting the reconstructed ligaments. Now, special exercises are required for sports person who want to get back to their sports. In general, the patient usually requires 5 to 6 months of physiotherapy to get back to his sports.